All right, we'll go ahead and start page number 10. And otitis media is important. We know what is otitis media, middle ear infection. So highlight the word and why. Remember, the word infection results in blocked eustachian tube. That's important word. In the middle ear, you have the tube, and those are the eustachian tube. Causes is important because we are going to teach. So what are the causes and what we are going to use the wording? It comes from respiratory infection. Child is keep on getting respiratory infection can lead to otitis media. So what is number one problem? Repeated respiratory infection. Second problem is smoking. Child is with passive smoking, breathing in the smoke. Third is normal in the babies. The tubes in the ear, eustachian tube, are shorter, wider, and straighter. That is one of the reasons the child is getting infection. Why? Because the tubes are short, wide, and straight. Very common answer is the second line, supine position, leaving the baby and giving the bottle to drink, and it can lead to infection. So what is one of the reason is here, supine position during feeding time. Normal answer is tubes are shorter, smoking, and repeated respiratory infection. See how your answers are? What are the reasons we can prevent otitis media, prevent respiratory infection, prevent smokers, don't feed them in supine position. Data collection. When they have middle ear infection, what does the child has here is the fever, high fever, 103 and 104. So what is otitis media? Middle ear infection. Child gets infection, fever is there. And next line is on the same line, rolling head, pulling ear or rubbing. Pain. So write down the word, they have pain in their ear. Because of the pain, they're rolling side to side, pulling or rubbing. Restlessness, irritability. Child has a lot of pain, they become very irritable. Now, tympanic membrane. Lot of question when you're looking ear exam. Otoscope. You're using otoscope to check the ear, and what would you see in the ear is red, bulging tympanic membrane. Everyone should remember in the middle ear, your tympanic membrane, the word eustachian tube can be in your question. So when you see tympanic membrane is bulging or retracting, or there is a opaque word, or there is a red word, that means the tympanic membrane infection. Are we clear? So what are you looking when you're checking the ear infection? How do you know child has infection? By looking that tympanic membrane. Many questions, I have came across, the question was the nurse is in the school checking the child's ear, and child tympanic membrane is opaque and red. What you should ask, are you having any fever? That was the answer. Why? It shows infection. So what do you look in the middle ear infection? The tympanic membrane. And also, what is the reason for child is getting otitis media is the tubing are shorter, eustachian tube. Everyone should remember, goes in anatomy part of the ear, tympanic membrane and eustachian tube. Intervention, and it can cause rupture if the pressure is high, but then if the membrane get ruptured, the pain and fever can subside. What do you do the child in intervention? Number one, teaching. Feed the child in upright position, always, not in supine position. That's number one answer. When the child has otitis media because of pain, your diet, underline the word soft diet. What diet do we give them? Soft diet. Avoid chewing and local heat, maybe. Child can lay on that same side, is okay. Clean the ear. How? Second line, with a soft cloth or maybe a wig. Antibiotic is infection. Completing antibiotic is important. Amoxicillin, maybe erythromycin, and antipyretic. You can give them for fever and for pain, and Tylenol, and also for how long the child would get the antibiotic, maybe 7 to 10 days. What do you teach the mother? Complete all antibiotic. All your drugs must be taken as prescribed by the doctors. Complications are, what are the complications after middle ear infection? Mastoiditis. Mastoid process right here, infection. Mastoid process is called mastoiditis behind the ear right here, and that can get infection. Then you have is tinnitus, but I write down the word meningitis. It can lead to meningitis. And third complication, very important, hearing loss. What would you teach the mother after they finish antibiotic? Come back and check. What are you checking? Hearing test. Why? Because it can lead to complications. So what are you monitoring? 3 complications: mastoiditis, meningitis, and hearing loss. Hearing evaluation 3 months later and check for after otitis media. Surgery, meningeotomy word, is done. Insertion of the tube to equalize the pressure. So meningeotomy, ear surgery, and they're putting the tube. Tube may stay for weeks or year. What is the complication? The tube can come out, extrusion, failure to heal, and also avoid them going in the water. Ear plug is important during bath, shampoo, swimming, diving, and submerging. So everyone, otitis media, very important teaching question, feeding in upright position. Avoid supine, complications, meningitis, hearing loss, very important. Check for hearing test is after antibiotic are completed, hearing evaluation 3 months later, and if they have meningeotomy, avoid any water going in the ear. Tonsillitis question, or tonsillectomy or adenectomy. What is the time when they do the surgery, tonsillectomy? When the child has problem, underline the word swallowing. You can't swallow. Tonsils are big, but the problem is here, swallowing. Maybe child need to go for tonsillectomy. These are the reason for tonsillectomy. Mouth odor, infection, breathing through the mouth, fever. And last line, breathing, snoring, sleep apnea. So what are the main reasons? You don't want to remove the tonsils unless there is really a problem. Why? Because tonsils protect us from infection. So what are the reasons are either they cannot breathe or they cannot swallow or bad infection. Are we clear? Those are the reasons you're going to go for tonsillectomy. Before child is going for tonsillectomy, we all know check the bleeding and clotting. But number 2, because the children, any loose teeth are there, can lead to aspiration during surgery. So check for any loose tooth. Tonsillectomy not done before 3 years of age. They plan to do it later, but not very early because of immunity and the infection. Complications is bleeding, very important, monitor after surgery, bleeding. Position, prone position or sideline position. And monitor, suction you can keep, but you don't want to unless really a problem, but keep them available. But what do you monitor for? Bleeding. Frequent swallowing, sign of bleeding. What do you do? Child is having frequent swallowing. Your answer would be turn them on the side. Why? Prevent aspiration. Second thing, notify immediately to your RN or to your maybe the physician. Discourage. Don't let them cough. and clear throat. Why? It will cause bleeding. Everyone should know prawn position, frequent swallowing, turn them when child is having aspiration problem, turn them on the side. Do not let them cough and clear the throat. Cold drinks are good. Non-citrus, because it causes pain. Non-carbonated. Avoid milk. Avoid red color drink, because you won't know if they're vomiting or is the red color drink. Are we clear? So these are the drinks you will avoid. Non-citrus and non-carbonated beverages. That means don't give carbonated, don't give with citrus. And also give red color. Milk is not good. And do not give straw, fork, and sharp object. After child goes home, avoid the croup for 2 weeks for infection. If the child is having pain in the ear or fever, need to notify, sign of infection. So everyone is okay on tonsillectomy. Position is important. What do you discourage? And next page is nose bleeding or epistaxis. What is one of the reasons for nose bleeding is? What is the reason for nose bleeding? High blood pressure. Remember, a lot of questions. Someone is having nose bleeding repeatedly. Yes, dry weather and picking up the nose can be, but remember, is your blood pressure. So check the blood pressure. But why I have it here, we all know for what do you do nose bleeding, but question, how long do you apply the pressure? Number 2, 10 minutes. You should leave the pressure on, and you do have in a lot of books that question. And they can apply the ice. And if bleeding is persisting, leaning forward, they need to lean forward. And if it didn't stop, then what do they do? Number 4, packing or cauterization, means they're burning that blood vessel. So where you apply your first aid treatment, applying pressure, cold. If it didn't help and it's profuse bleeding, maybe another treatment, cauterization and packing. Next is croup disease in the child. Is called LTB or laryngeotracheobronchitis. If they give the word croup, remember the word is laryngeotracheobronchitis, and that's the infection. Inflammation of, what is croup is? Inflammation of larynx, trachea, bronchi, and it can be viral or it can be bacterial. There's inflammation. And common in 3 months of age and 8 years of age. Both age group are common. And when does it come? Croup, common second line, nighttime. And it is with upper respiratory infection. So croup is upper respiratory. Upper respiratory means larynx, trachea, bronchi infection. And what is the problem with the child when they have this infection is fever, low-grade fever. They do have fever, but problem are last line respiratory stridor. And they cannot breathe, and they are having nasal flaring. And it gets worse in the nighttime. So they're coughing, they may have slight fever, but what is the biggest problem in croup is the nighttime and the breathing problem. What intervention you will go? Airway is good. Elevate, open the airway, make sure they're able to breathe. Elevate the head of the bed. Vaporizer, humidifier. And also, when child is at home, take them in the cold place, such as basement. You can go in cold basement and maybe garage. Open up in the nighttime and in the cool night air. You can go outside night, cold day, cold night, and open the freezer so they can get the cold air. So what are we breathing in here is the cold air. And cold humidifier, raising the head is good. Avoid cough syrup. What is cough syrup can cause? Thicken the secretion. And that's why it can obstruct more breathing problem. What do you have available here? Epinephrine. Next is monitor for stridor because they can't breathe in. you may have to give epinephrine. Antibiotic may be given to treat infection. What do you keep in the room? Resuscitation. Everyone is okay? Hand washing is good. I want you to add there liquids. If they're giving you, what liquids do you give? Child is having cold. Give all cold, not hot liquids. So remember, any food you are giving child with the cold food, cold liquids, you will go on. So laryngeal tracheobronchitis is called croup. Remember, everything cold, avoid cough syrup, and they also have breathing problem, and you will need resuscitative equipment. Next word is cystic fibrosis. Child with cystic fibrosis has, underlined the word, multi-system. Very important, multi-system disorder. And what is the problem with the child here? Exocrine gland at the end. So when we are talking about cystic fibrosis, what is the child is having here is multi-system. Number one, not only one system, it affects multi-system. And second word is exocrine gland. We have endocrine gland, we have exocrine gland. So what gland is? Endocrine glands are your thyroid gland, adrenal gland. Exocrine gland, you're producing other body fluid, and it affects different system. So underline the word, second line, lungs. First problem are lungs problem. And they are having a problem in breathing, and the phlegm is very thick. So lung disease, and they can give that improved second line respiratory function. So what is the problem in the lungs are breathing problem, respiratory. So remember, they cannot breathe in, problem with breathing. And they can treat them, underline the word, pulmosin, enzyme, to help them improving breathing and preventing them from emphysema atelectasis. And remember the word hypoxia. What is the word hypoxia? They are having lack of oxygen. And remember, when they cannot get enough oxygenation, they're not going to be able to breathe in. Antibiotic, if there is infection in the lungs, maybe your answer antibiotic. And maybe you have to give them chest physiotherapy, CPT, bronchodilator. We might have to give them bronchodilator to open the lung. So remember, is always for child is the breathing problem. So that means what is in the lungs are, because all the phlegms are very thick and they cannot breathe in. So remember the word respiratory problem, that means they're not able to breathe. And hypoxia word, they're not getting oxygen. What do you do? Maybe if they have infection, give them antibiotic, give them CPT, give them bronchodilator. Remember, next word is children. We are talking about the Peds. Your question is going to be the toy. And what kind of toy do you give? Not because of the age. Remember, the toy is something they can sit and play with that. You're not going to give bike. Even they can go on bike. Why? Breathing problem. So there may not be any question. Maybe question, child is admitted with cystic fibrosis. What toy? Child is 5 years old. You can give them bike, yes, but you don't want to. And what can you give them? Maybe according to age appropriate. Anything, maybe building the blocks, maybe the puzzle you have. That means prevent them from what? More exercise. You give them, they can breathe in. So remember, a lot of toys are going to be in your disease process. So you're going to give them the respiratory. Second problem, they have GI. What is in GI is they're lacking pancreatic enzyme. And in the pancreatic enzyme is the obstruction, and they're not getting from the pancreas enough or thick enzyme. And what would be a problem with them? What is the pancreatic enzyme helping digestion of? fat. So what kind of stool they will have? Again, statatoria, maybe your answer. Foul-smelling stool. So write down the word, a stool can be very foul-smelling, and the word they're losing a lot of fat. What do you give them when they're eating food? Are pancreatic enzyme. I want you to add there viocase. Viocase is pancreatic enzyme. You give them. When do you give viocase? With time, with meal, before child is eating. Everyone is okay? So second thing I said GI. What is in GI? Pancreatic enzyme are less. They're not getting enough pancreatic enzyme. So what is the problem with the child here? They're not able to digest their fat, and what kind of stool they have, again, is more statatoria and maybe more frothy, foul-smelling. And the next thing is diet question. What diet do you give them? You increase. You can give more protein, more carb, but what do we cut down here? Fat. So remember the diet question. Cut down the diet low in fat. You can increase protein, you can increase carb, and you can low fat diet. Now you do have also, you give with the food is your viocase so they can digest, and give them fat soluble vitamin. What are the fat soluble vitamins are again? A, D, E, K. Is all your knowledge. Questions are not going to be a very straight question. Just if you know, you will remember. Any questions they're throwing, child is admitted with cystic fibrosis, could be for answer for your breathing problem, could be answer for your toys, could be answer how do you treat them? Bronchodilator. How do you treat them? CPT. What do you prevent them? Lung infection. What are you monitoring? Oxygenation. Are we clear? Second question, maybe they didn't give anything. What diet do you give to the child? Increase everything. What do you cut down here? Fat. What do you increase here? Pancreatic enzyme. What do you increase in that extra? Is vitamin A, D, E, K, because they're missing. What kind of stool they have? Statatoria. So, and another thing is in the diet is you have is extra salt. So remember, because I'm talking diet, remember the word they need more salt. Why? Because next problem I will talk about integumentary system. What happened on the skin is they're losing, you have in the last one integumentary, let me finish, the last integumentary is a lot of sodium they're losing and chloride in their sweat and also in their body fluid, tears and sweat. So when mother kissed the baby, what does she complain here? My baby is very salty. So what are they losing here? Salt. Maybe that one question. Mother complains child is losing a lot of, child is very salty. What is the problem with the child? Your answer is cystic fibrosis. What do you add here? You give more salt because they're losing a lot of salt. Next is, underline that, normal sodium is 40 mcg under integumentary. 60 is positive. So how do you diagnose them? Sweat test. How do you diagnose them? Your x-ray to look lungs. How do you diagnose them? Looking the stool with the statatoria. Everyone is okay? Last problem. Child grows and they will have problem with reproductive system. And the problem is here, is it blocking the sperm because the secretions are so thick that the sperms are not able to pass and lead to what? A sterility. So everyone should remember cystic fibrosis babies have, number one, multi-system. I also want you in the first line, I forgot that, autosomal. There are questions and they may on that, so recessive trait disease and exocrine gland disease. What are the three problems I hear? Lungs, GI, and they're losing a lot of salt through the skin. And the last one, reproductive, when they grow, they may have problem with maybe your ancestrality, and monitor for that, and that can lead to there. So everyone should remember these answers on the children care. Now I will move on to the hydrocephalus on the same page. We all know what is hydrocephalus is. What is too much problem here? Underline the word cerebral spinal fluid. What is hydrocephalus? Too much of fluid in the absorption and production. They're not producing, and also what are they doing? They're having too much of fluid in the cerebral spinal fluid. So what is hydrocephalus is the problem with is the production or absorption. And what can be caused here is imbalance with that tumor, hemorrhage, infection, trauma can lead to, and head enlargement. When you see the babies, what would you see in the babies? The head is enlarged. So remember, everyone, for exam, we must know normal head circumference. I do have, we are keep talking today and tomorrow in Peds and OB, we must know, because all the normal growth and developed newborn babies important. So when you see the bigger size of the skull is hydrocephalus. And what do you have more here? Cerebral spinal fluid. What do you monitor? Child who is born with hydrocephalus. Second line, ICP. What do you monitor? ICP. And what do you monitor in ICP is going the third line. Fontanelles are bulging, and irritability, lethargic, nystagmus, high shrill cry, and seizure. They did not give hydrocephalus, and they give you a question, newborn baby. And they may not give bulging fontanelle, but they may give child is irritable, child is lethargic, shrill cry, and child is having seizure. What are you monitoring? ICP. Are we clear? Could be any reason with ICP, but these are the signs, not only remembering bulging fontanelle. We must know cry, shrill cry, lethargic, irritability, and what are you monitoring? Neurological assessment. What is hydrocephalus is? Too much of fluid, everyone is okay. What are we monitoring here? ICP, sign of ICP, bulging fontanelles, number one, we all know that. Pulsation, non-pulsating tense, and they are irritability, lethargic, abnormal eye movement. Second line, McQueen sign. What is a McQueen sign? Crackpot sound. When you're doing percussion, you have fluid in there, and what do you see? Sign is McQueen sign, crackpot sound on percussion. That's one of the signs. What do you do when the child is born with hydrocephalus? Number one, we all monitor for ICP. Tell me what are the signs of ICP quickly is if you're monitoring. We all know level of consciousness, right? Okay. What is a very common sign would be in ICP, and very important here with hydrocephalus babies are. What are the signs of ICP? Yes, you're monitoring level of consciousness. And what would you monitor sign of ICP? Very important that we all know vomiting. Child would be frequently vomiting. Maybe answer, they're not asking you and saying, what do you monitor child who's vomiting here? Aspiration. And they're losing weight. They may not be able to keep a lot of fluid. So remember, level of consciousness, very important. Headache is there, but for the babies, it's not that important, but very important is vomiting. So I want you, make sure you write down vomiting, because they're vomiting, and so you have to feed them very carefully. And what do you monitor before they're going for surgery is their weight and prevent aspiration. What treatment is done for the babies are, they're going to put the shunt. There are two kinds of shunt we have here. Is number one, ventriculoperitoneal shunt. The fluid is draining from ventricle to the brain. There are ventricles in the brain. And draining into where? Underline the word peritoneal cavity. And number two is arterioventricular shunt. And the fluid is draining where? In the right atrium. So where is the fluid is draining here? Right atrium. So everyone is okay? Hydrocephalus, number one. Enlarged head, we all know. Cerebral spinal fluid, what do you monitor? ICP. Very important, you are monitoring what? Vomiting question here. What will be done for the child? They will be scheduled for surgery for and shunt. Any question? I'm going to go over a little bit on shunt, but let's move on to the next page. Intervention, pre-op care is positioning is important because the pressure of the head can cause skin breakdown. Underline the word is acrylic mattress. Some question you may have a sheepskin. Sheepskin, that's a padding on the bed or under the head. Sheepskin can be used to prevent skin breakdown because the pressure of the head. Keep them NPO. If your surgery, they're going. But until they're going for surgery, feed them carefully. Why? Because they're having vomiting and preventing aspiration. Post-op care, what would you do if they're saying, first one, peritoneal shunt. So what do you monitor when the child comes after shunt is put it on? Position, flat. And what do you monitor after shunt again? Is ICP. If ICP goes up, then you raise the head of the bed and you will go on semi-Fowler's position. What do we put it on? Semi-Fowler's position. But when the child is coming, you have underlined the word flat. And then second line, you have 15 to 30 degree, right down there, semi-Fowler's. When ICP is up. Are we okay? If you're going to turn them unoperated side, which is in the first line. So what is your turning is? If they're saying child has shunt on the right side, what side do you turn the child? Is on the left side. Are we okay? So turn on unaffected side. What do you monitor? ICP. What is ICP? Level of consciousness. You're monitoring vomiting and your monitoring is vital sign. But very important two things here, vomiting and this. Now when they're draining in the stomach, I want you to add there peritoneal shunt. So what are you monitoring? Peritoneum. And what do you monitor peritoneum? Abdominal distension. So write down the word abdominal distension. And monitor for shunt malfunctioning, lethargic, level of consciousness. Headache or vomiting, that means ICP is high. So everyone must know is hydrocephalus and the treatment is shunt. What do you monitor after shunt is the positioning, monitor for vomiting and prevent them from aspiration. Next I'm going to move on, a spina bifida. Now there are a couple of kinds of spina bifida we have here. And what is spina bifida is second line occulta and third one is cystica. In cystica you have two, meningocele and it says myelomeningocele. I want you to remember for exam when you have questions spina bifida, and if you're doing other questions, you may not see the word spina bifida and they had myelomeningocele or meningocele. When you have myelomeningocele And now you go on myelomeningocele. What do you monitor a child who is born with myelomeningocele? Underline the word is here, is neurological defect. So child who is born with a spinal bifida or myelomeningocele. Question. What do you monitor? What do you monitor? Neurological assessment. Are we clear? So what does it affect? Myelomeningocele and spinal bifida babies is neurological. What is spinal bifida is? What is spinal bifida is? Myelomeningocele is defect, protrusion of meninges. What is coming out? And where is spinal bifida? If you don't know, it's here in the lower part of the sacrum, is called lumbosacral area. Remember, it's not here in the neck. It's not here. Here on the lumbosacral area. Okay? And where is the problem here? Is they are coming out what? Meninges. What is meninges are? Covering of the brain and the spinal cord is the covering. And cerebral spinal fluid. And third thing, they have nerve. And fourth thing, they have spinal cord. So it's completely neural system. Your meninges, cord, nerve, and the spinal cord. And that is why all are affected. And where is the spinal bifida? Lumbosacral, right here. And babies, when they're born, you can see a sac is coming out right here. That is why we will talk about what do you do, but let's understand first how your questions are going to be. Child is born with spinal bifida and myelomeningocele. What are we monitoring them? Neurological assessment. Now let's see what is neurological. It's a complete neural problem. And what is the neurological problem you're going to monitor? Let's go data collection. Babies are paralyzed. Babies are paralyzed. So underline the word, they are paralysis. Upper extremities, okay. Because it's right here, they're totally paralyzed. So what is first thing? Paralyzed. When somebody is paralyzed, what are you assessing them? Underline the word bladder. They won't be able to pee. And bowel, they won't be able to have bowel movement because there is no sensation, there is no feeling, and they cannot empty the bladder. So your question is going to be, baby is born with spinal bifida, what are you assessing? Bladder. First thing. And we all know they're paralyzed baby and they have bowel problem. What do you assess a child who is born with myelomeningocele? They may have also hydrocephalus. So you are assessing also the skull. Underline the word hip problem, joint problem, hip deformity. Some of the babies, they're born and their legs are not completely developed. They're weak. Maybe dislocation of hip, maybe abnormal feet. Are we clear? See, not one answer, not a simple question. Child is born with spinal bifida. What are we assessing? Number one, neurological. Remember, second thing, they cannot pee and they will have problem in bowel movement and they're paralyzed. What do you assess a baby who is born with spinal bifida? Make sure you check their head circumference. Make sure you assess their leg. They may have deformity. They have deformity on their feet and abnormalities with their fracture. Intervention, ICP. What are you monitoring baby who's born with spinal bifida? May not be answer neurological, highlight the word ICP. Next, what do you do for the child? Now we all know what are we going to assess. Next question, child is born with myelomeningocele. What do you do? Underline the word after hydrocephalus. Protect the sac. What are we protecting here? Sac And then what do you do? Cover with normal saline. Non-adherent dressing. It shouldn't stick. Maintaining moisture. Keep changing every 2 to 4 hours because you want to keep moisture. It can lead to dehydration. What position do you put? Underline is prone position. Third line, underline low tenderloin bird position. And also protect from trauma and contamination. Those two words are very important. Trauma. You don't want to cause trauma. And what are you preventing here? Contamination. What do you think child can get with contamination here? Meningitis. Are we clear? Child are born, and if you don't use a sterile technique and the child get meningitis infection, it can lead to what? Meningitis. If they ask you in exam, what would you use when their child is born? A sterile gloves. When you are covering, a sterile dressing. What are you preventing that sac from BM and from the urine? Why? Because it's open and child has a diaper or it can contaminate that. So what is your job here? To prevent infection. And you're using a sterile technique. And so that is good. Then you clean them and gently remove. And catheterization word. What would be the child would need? Catheterization. I want you to write down one more word. Creed method. What is a creed method is when you apply external pressure. Child did not pee. What would you do? C-R-E-E-D-S. Creed's method. What is a creed method? Child did not pee. Without catheterization, how do you empty the bladder? Applying the pressure from below umbilicus area and you're going towards the symphysis pubic area. So we all should know the Creed method. It's a nursing intervention. We all are nurses. We all should know how do you empty. Child is born with myelomeningocele. How do you empty the bladder? Answer maybe Creed method. What do you teach? Now, the catheterization may be another answer. Bowel program, increased fluid. Maybe child needs suppository. And very important, the children are born with spina bifida, their allergy to latex gloves. So highlight that latex gloves answer. Complications are babies born with this, hydrocephalus, UTI. Why UTI? Catheterization. They're going home, they live on catheter, and what does the catheter is going to lead here is infection. Now let me remind here, your question can be, baby had surgery, mother is taking home child, what would you teach after myelomeningocele? Now in your mind, remember, they will never be able to pee their own. So what do you monitor? Your answer may be bladder distension. What do you teach mother here? How to do intermittent catheterization, how to change the catheter, how to maintain sterile technique, and what do you give them? Monitor for bowel movement, increasing fiber, fluid, maybe. And I'll tell you, they cannot empty the bladder their own, and they cannot have bowel movement every day. They may need is enema or suppository. And they are not able to walk. They're wheelchair-bound patient. And what do you monitor for them? Because they're very weak all the time. Their bones are very weak here. And remember, is UTI. So complications can be what with the child here is the UTI. Okay, so everyone is okay with spina bifida questions are. I will go on Reyes syndrome. Reyes syndrome, I want you to highlight the word encephalopathy. And number 2 is causing liver changes. What is encephalopathy means is cerebral edema. Which child are you monitoring for Reyes syndrome are aspirin, underline that word, and viral infection, influenza, and varicella. So child and third line virus illnesses. So how do you get Reyes syndrome from aspirin? We say children don't give aspirin, can lead to viral infection. What are you monitoring if there's a question on Reyes syndrome? Encephalopathy means ICP. Write down that word. And liver, it affects the liver. Intervention are monitor ICP and monitor liver function test. Next page, meningitis is tomorrow. I will continue, so make sure you bring that package. But let me finish. Meningitis is bacterial and viral infection. Very important, we all know meningitis is bacterial and viral. What kind of isolation do you have for meningitis? Is droplet. First line, second line, lumbar puncture. You do lumbar puncture. What do you find in lumbar puncture is cloudy fluid. Underline the word, everything is increased, but the third line decreased glucose. Only for meningitis. Only for meningitis. This answer is only for meningitis. You do lumbar puncture. What do you find in lumbar puncture? What is low here? Glucose. But if there is infection, remember, they will have increased white blood count. You won't pick up for infection, but yes, meningitis, everything is high. Only you will go here is glucose is low. Bacterial meningitis is bad and comes from influenza, streptococcal, pneumonia, from mumps, and viral also. What are the data collection here? Fever. They have high fever. Underline the word knuckle rigidity. Patients start having knuckle rigidity with fever. Immediately you pick up, patient is going into meningitis. Now we'll move on, Kerning sign. What is a Kerning sign? Inability to flex the leg. So if you lift them and you bend their leg, they have a lot of pain. So remember word Kerning, K word with legs. You got to memorize somehow because they're going to make it more complicated and you got to read the question. And when you're moving or bending their leg, they have what? Pain on flexion of the leg. Brodowski's sign has neck flexion. So write down the word neck, something with the neck. And I want you to add there photophobia. So what is the problem with the babies here are with meningitis? They're sensitive to light and they're having fever and they have knuckle rigidity. Intervention, what isolation you will go here is your droplet and start antibiotic and monitor consciousness, monitor for seizure. How do you prevent them? By giving prophylactic treatment and giving meningococcal vaccine. So is highlight that. Everyone should know the precaution. Everyone should know Kerning sign, Brodowski sign, knuckle rigidity, photophobia, isolation, and antibiotic. I'm going to stop here now.